Welcome.
Hey, I'm
Hi.
glad to be here.
I'm excited to finally be doing this. I feel like we've been talking about this for a couple years. For those listeners who don't know, which is probably all of the listeners, Matt did my veneers, was it 3 years ago now or almost 4?
I feel like it was 4 years.
I think it was 2020,
Okay,
right? So yeah,
yeah.
we're coming up on 4. And the topic of veneers and cosmetic dentistry has come up so much when I ask people what they want to hear about. And it's a topic that I've never covered on the podcast because I felt like it's such a visual thing. And I think that when you talk about like facial surgery, people can kind of picture what we're talking about. Whereas with teeth, when there's so much nuance, right, in your work, it's hard for people to get it. But we decided to go for it because so many people wanted to know. So why don't you just tell everybody a little bit about what you do, because it's different from typical cosmetic dentistry.
Yeah. So my background was in something called bio-mimetic dentistry, which means like copying nature. And a lot of dentistry should be focused on copying nature because you're restoring teeth. It should be natural. It should be functional. So biomimetic dentistry is this whole philosophy where all restorative dentistry is with the aim of replicating the tooth in how it looks, how it functions. So it's not just the appearance, but it's also kind of like the longevity, the strength, the seal. It's a very meticulous type of dentistry. It takes more time to do, but that's what I was trained in dental school. And I basically was so in love with that concept that I knew I had to practice that way. And I didn't see any opportunities to do that because it's so abnormal. Like most of dentistry is kind of like drill and fill, quick turnover, all about profit and production. So I basically had to start my own office right out of school and basically develop this type of dentistry. And now it's become more and more common because more and more dentists want to practice this way. It feels good, it's rewarding, and you know that it's quality work.
Mm-hmm. Why is it so important to maintain things like the structural integrity? I don't know if that's the terminology of the tooth. Like, why do you think there is this shift now towards this type of approach?
There's a lot of reasons. So like, first of all, if you think about it, when you're restoring a tooth, your goal is to make it better than you left it. And when you're taking a lot away to do a cosmetic procedure or a crown, I mean, everything I'm talking about applies to front and back teeth. It's very like encompassing. But when you take a lot away and you restore it with something artificial, you have this concept that the tooth is less valuable than the space you make for a bigger crown or a bigger veneer. But the reality is the best combination to strengthen the tooth and to look better is to take the least away. And that means when you're doing veneers, you can do very minimal preparation. When you're restoring back teeth, instead of jumping to a crown, you can do fillings, inlays, and onlays, all partial coverage restorations. And the huge benefit to patients is security of the tooth, which includes not losing the tooth. Because over a lifetime, there's this concept I talk about in all my courses. I teach courses on this type of dentistry. And one of the concepts is called the tooth cycle of death, which basically sounds very scary, but it's very normal. I mean, if you think about the traditional way dentistry is done, people have a silver filling that gets replaced with a white filling. Over the course of several rounds of treatment, they lose a tooth and get an implant. It's a very normal thing for patients to go from A to B to crown to implant. And that can be avoided by being more conservative at the beginning. You can never bring back the tooth structure you remove, but you can restore the teeth in so many ways. And it might take a little more time, but that's the type of quality dentistry that matters for patients because you can prevent that. And I can oftentimes save teeth that people say are unrestorable because when you are doing this type of dentistry, you become a master of adhesion. And there's a lot of teeth that I save. I have a whole lecture on teeth that were treatment planned for extraction and had a hopeless prognosis, but they're now on year 8, 9, 10, and even 12. So
Wow.
12 years of success.
I'm getting a little nervous as you're talking.
Oh, no.
Because I feel like, when I came to you, I had 3 rounds of veneers, I think, and I went about it the wrong way from the beginning. Initially, when I first did it, I actually did, what is it? Bonding?
Yeah.
What is that called?
Composite bonding. Like,
Composite
did they just
bonding,
put right on
yes.
top of your tooth? Right?
Yeah. Because I just had like a little bit of unevenness in my top teeth that I wanted to fix and I couldn't really afford anything else. So I did that. It was fine for what it was. And then it kind of got discolored, which I think is typical because it's more porous, right?
Yeah.
And then I went and tried to save money again
Yeah.
and had my top ones done and they were huge. And then I went to have them done again. And this doctor that I went to said that I should do 22 teeth,
Right.
top and bottom.
Right.
And he drilled filed the shit out of my teeth. I mean, there was like little nubs, right? And then those were not great either. And that was when I went to see you. So I guess 3 rounds. But what are the implications of, doesn't have to be about me, but like having your tooth filed down to that? And what is like the maintenance, and how can you prevent things like the cycle of death?
Okay, so just really quick, I want to mention bondings are more porous and they do discolor over time, but the better, they can be done really well. Like it's a procedure I do. I don't choose to do it like on 10 teeth. I think it makes sense for 1, 2, 4. But as you get more and more, the advantages become less and less versus ceramic, especially when you do minimal tooth shaving. One of the reasons patients love it is because it can be done very conservatively, but so can veneers if you do the right approach. Now,
sorry, I want to pause there.
Sure.
What is bonding good for? Like, who is the ideal bonding patient?
Chipped corner of a tooth, 1 or 2 teeth, a trauma where you fractured 1 tooth. Like it's very hard to match 1 veneer to your natural teeth. The optical properties of ceramic can be amazing, but they don't necessarily have the same properties of your tooth. So imagine you're at a nightclub or black light or even direct bright sunlight. You might have 1 tooth, like it might be good in some lighting, but not others. Whereas with the bonding, you actually the optical properties of composite are very close to enamel, and so that means that under different lighting you can probably get a better blend. And you can also customize it. Like imagine it's really close but not perfect. You can just trim a little bit away and add to it, but it does have its disadvantages. It wears faster, and when you're trying to do 10 teeth, this is hand artistry. You're doing it in the mouth. When we do ceramic, we do it out of the mouth. So you can look at it and hold it and look at it at all different angles. Whereas in the mouth, the patient's there, they're getting tired. And so you do it over several appointments and you spend tons of time. But I think the more and more teeth you do, the less advantageous it comes. But when it's 1 tooth, 2 teeth, chipped corner, even chipped incisal edge, chipped edge of a tooth, then it makes a lot of sense because you're not going to go, see, that's the frustrating thing. Some people come in with 1 chipped tooth, and the dentist who knows that the 1 veneer is not only challenging, but probably not going to be the best option, starts treatment planning 10, and that's where bonding's perfect. You can do 1, 2, up to 4 bondings. People do 10 as well, but it starts to become a maintenance issue. It's not my first choice for multiple teeth, but for those other options, it's the best.
Okay.
Yeah.
And then back to, having more aggressive
tooth preparations.
Yes.
Yeah. So the implications, basically a couple. One, the more tooth, so like I said, when you remove tooth structure, you can't bring it back. Okay. You can always remove it later, but you can't reverse it. And what happens is the more tooth structure you remove, the higher the chance that you're going to have a situation that causes inflammation of the nerve and leads to root canals. That's well documented. So the more tooth structure you remove, the higher the incidence of root canals. Optically, from my perspective, the less you remove, the better, because you can piggyback on the tooth's natural properties and enhance them with a thin veneer. But when you go with something thick, you have to recreate that depth and color and everything. And people do it because it's easier, but not necessarily because it's better. But the problem is the better way, which is the minimal prep, it's harder. So it depends on the skill of the dentist and the technician. It's like really, you have to devote to being able to do things in a small amount of space, planning meticulously. But when you do the other way, when you shave a lot, you have the root canal incidence, you have higher chance of fracture. Putting margins, which means where the veneer or the crown ends near the gum, all the way around the tooth, which is what a crown is, that creates more and more problems where it's more difficult to maintain, more likely to fail, more likely to irritate the gums. But the good news is, type of dentistry that I do, biomimetic dentistry, I restore teeth like that. And I wouldn't say I can make them as good as if we had never shaved that much away, but we can still have a really good prognosis because it not only prevents that situation, but it also gives us the skill set and tools to restore those with a favorable long-term prognosis and minimize those things. But, I would say any patient that has a tooth that's prepared for a crown, this is in the literature, has a higher chance of a root canal just because so much was removed. And sometimes it takes many years for that to manifest, but it's a well-documented fact.
It sounds like, is it almost easier for a dentist to just say, well, you need 10 because that way they can just make it all cohesive, and it's harder to do that really, it sounds like again, more nuanced work where
Yeah.
you're trying to match just 4 teeth with the rest of the teeth or something like that.
It is. And so like that's why I like the bonding for smaller things. But if the tooth's already been prepped for a crown, you're going to a bond. Not going to bonding. You're going to a veneer or a crown or something. You can't go backwards. Like, I mean, technically you could try, but it doesn't make sense to try to make a full crown in the mouth. So what you do is the bonding is usually for chipped corner, worn tooth, or just on top of your existing teeth to make them bigger or more pleasing. But a veneer is also being used in situations where you're replacing a veneer or you're doing multiple teeth. I think 10 is the easier way, but it's also oftentimes the best. I want to mention that when you're doing a smile makeover, there's different types of aesthetics. So one type of aesthetic is, let's say you don't look at the patient's face or their lips, you're just looking at the teeth in a photograph. Things can look amazing, but when the patient smiles, if they don't show their teeth, if it's not the right length and proportion, then you would say it has nice dental aesthetics, but not facial aesthetics. It's got to be, there's like 4 levels of these things. So when you're doing 10, you get to address position, size, length, color, everything. Imagine you want a whiter smile and you've tried whitening, but didn't work, or you want even whiter. If you end up doing 4 teeth, how does that going to look with the teeth in the back that don't blend? So when I do 4 teeth, even for veneers, sometimes that comes up, I am shooting for matching the remaining teeth, okay? And I am also trying to stay within my boundaries. Like if the teeth are X length, you're trying to stay within them. And a big problem is oftentimes people try to squeeze out a little bit of extra length and improve the smile on 4 teeth. But now it doesn't fit the rest. It creates functional problems and it looks strange. Patients often come, and that's one of the common cases I do. And I try to tell them, if it were me, I would do more in this case. And I would have told you that from the beginning, but it's tempting to just try to get, it starts with the 1 tooth, right?
Yeah.
And oftentimes the dentist says, let's do 4 so we can blend it in, but I'll make it a little bit longer, but it just looks less and less natural.
It seems like so many people approach it through, what did you call it? Dental, like where they're only looking at the smile.
Dental aesthetics.
Dental aesthetic.
Yeah.
They're not looking at it in proportion to the rest of the face, because especially in LA, you can see veneers on somebody from a mile away in so many cases, because they just have this kind of like one size fits all, chiclet, very white,
one color,
very opaque. Which is what I had. Very big. And you wonder like, how is this happening? But it's like, I could see how it would look maybe better just close up in a picture. But then when you see it in proportion with somebody's entire face, it like does not fit at all.
I agree. And there's a couple of reasons that happens. One of them being that sometimes they look good in photographs. Sometimes, oftentimes it's based on the dentist and the lab technician going with trying to do the same shape every single time, trying to get this Hollywood appearance. And what I've found over the years is nothing beats nature. Like over time, every trend ends up going back to natural but beautiful. So we do different shapes for every case. I design them myself because when I'm working when you're doing a minimal prep case, you're trying to be very conservative, the littlest space is available. So you have to know the design inside and out. You have to know if the patient, we preview every design. So like when we're doing these things, we do a temporary, I don't know if you remember, we kind of did that process. And let's say you say, I want this one to be same length as that one. I want to know instantly, but when I was designing, I saw your gum levels here. Do you want to get gum surgery? I don't want to go in circles where I just say, yeah, sure, I'll tell the lab to do that. You end up getting to a situation where patients just accept instead of educating, showing the possibilities. So a lot of dentists do the same size, same shape. They try to really make it like a production workflow that's focused on convenience rather than quality and being, real customer unique. So that's what you see. And then it drives me crazy when they're one color, like there's different materials, and we'll talk about that, I'm sure. But I don't it's not supposed to be one color. You can have white and beautiful. And the goal should be, when you're out and about, for someone to say, I love your teeth, I love your smile, not who did your veneers or I love your veneers. And that's what I really strive for and consistently achieve.
Yes. I'll brag on your behalf.
Thank you.
I was out to dinner a few weeks ago with Chuck's, I guess he's his agent.
Yeah.
He's at UTA, and his wife, and we were talking about veneers. And I said, oh yeah, well, I got mine done. And they were like, really?
Yeah.
And I was smiling at the table and trying to show them. And they were like, oh, we had no idea because they look so natural. And we can throw up a picture of my before and after so that the listeners can see this, whether you're watching on YouTube or Instagram or TikTok. But I think it's important because you look at the before picture of my teeth and you think, okay, those look pretty good, you know, if you're just looking at my mouth, again, not looking at my whole face.
Right.
But then you look at the bottom and just these differences, you know, millimeters or micro, I don't even know, like probably less than that.
Millimeters, half a millimeter.
Millimeters in size, you know, the translucency at the bottom of the teeth. They look like just teeth. They don't look like veneers.
Teeth, yeah. And when we throw that picture up, I want to mention, like, if you look really close at it, there's another level of aesthetics after dental, which is really more the teeth. There's dentogingival aesthetics, which means the gums. And the gums play a huge role. I mean, not everyone can show a little bit of gum when they smile. Some people show too much gum when they smile. There's all these differences. But when we look at your case, notice closely how the gums were like suffocated before. Like the teeth were like pushing the papilla, which is the pointy area between the teeth. It was pushing it down, creating an inflamed look. And a lot of the natural look of a smile comes down to also getting we call it pink aesthetics, the gingival aesthetics, also in line. It's probably one of the most challenging things because what you have to do is create a biologically non-irritating and acceptable result that the body recovers. And it doesn't happen right away. I have your pictures from like 2 or 3 weeks after we saw you. And I was like, okay, good. But then when I got like, I think it was a year, I have to double check, but like another post-op photo where the gums had fully matured around it, they look just like real teeth. They're being tolerated. The gums aren't irritated. That makes a huge difference in those things too. So that's where the functional side also matters. You can do beautiful ceramic, but if it's poorly bonded, if it has an overhang, if it has open margins, things that create irritation, you're still not going to succeed.
I want to get into kind of start to finish the process of veneers because I know everybody is curious. But first, I did want to ask you, is there a role of gum health in overall health? I feel like this is so trendy right now. Everyone's talking about gum health and, you know, kind of commercial dental products and fluoride and the oral microbiome and how it contributes to our overall well-being. So I would love to hear a little bit about that.
Yeah. So mouth is part of your body. It's the entryway for a lot of different problems. It can lead to, in severe instances, poor gum health can lead to death. There's been people that have died from brain swelling from untreated infections that resulted in periodontal infections and spread. But most commonly, it's associated, it's like a contributing factor to a lot of things like diabetes, high blood pressure, cardiovascular health, etc. And so it's, you know, it's a good look inside your body. If you have inflammation from there, it's going to be hard to say it's isolated right there. There's all sorts of studies looking at these things, but for the most part, it ends up being a contributing factor, not necessarily 100% direct role. Lots of things in life do come down to multiple different factors that contribute to them. And this is a very important thing to understand because people tend to think it's a totally separate part of their body, but it's all part of you. You know, it does end up in the same circulatory system. You know, when there's inflammation, it gets into the bloodstream. That's how that sort of situation leads to someone getting like brain swelling and death. It's when the bacteria enters, causes sepsis, and leads to other parts of the body. And it can also do something called endocarditis, where you can have the bacteria spread to the heart if you have a predisposition. But a healthy person, usually it won't go from like healthy heart, healthy everything, but inflammation of the mouth to that. But, you know, it's like the thing that might push it over the edge for the right or wrong person. Yeah.
What are some things that people can do to prevent that? Just regular cleanings, regular flossing, all of that?
So you can floss once or twice a day. Once if you're doing a great job, twice if you need to make up. You got to get your regular cleanings because at the end of the day, even myself, it's impossible for 90-something% of people to bypass getting professional cleanings and do a good job long term. When people do that, they tend to come back with inflammation called gingivitis and eventually periodontal disease. So professional cleanings, flossing, brushing, proper brushing technique is very important. And then you can, depending on the person and their predisposition to these things, they may need to incorporate some sort of rinse. The cheap, economical ones, saltwater rinses, and I have a YouTube video on that. And other options, there's all sorts of professional mouthwashes out there. I really like one called Closis. It's very natural and it does a great job killing bacteria. But for the average person, brushing and flossing consistently is the key.
Mm-hmm. And is it true that things like scope and Listerine kill the good bacteria as well? Because that's kind of what's going around right now on social.
So I don't like alcohol containing ones, and not necessarily all those, like scope doesn't always have that, but I think it does. But the thing is, usually there's something going on where they're saying it's not true. But from what I've always learned and what I still believe is the good bacteria populates first. So you kill everything and then the good flora is what populates first. Now, I'm not trying to sterilize the mouth, and you shouldn't be either. The real goal is to minimize the source of the problem. And really the source of the problem isn't the bacteria. It's what the bacteria gets access to. Carbohydrates, food left behind. You know, a lot of these karyogenic bacteria are thriving on that. They're not eating your tooth. Everyone thinks cavities and periodontal disease comes from the bacteria directly attacking you. No, it's looking for opportunities where food is left behind under the gums, between the teeth. So you can shift the flora by having good oral hygiene and minimizing the plaque, the biofilm, and all the things that are basically the nutrition source for these bacteria.
And then real quick, toothpaste. Any toothpaste that you recommend?
Natural is always great, first of all. Fluoride is very beneficial, but I think if you're doing a great job mechanically removing things, you don't necessarily need fluoride. So fluoride helps minimize, or actually I want to say it gives the tooth extra protection from demineralization, which is dissolving in acid. Bacteria produce acid, and if you have fluoride on the surface of the tooth, it makes it resistant to that dissolving. But if you have great oral hygiene, I don't think you need that. And there's a big trend towards moving away from fluoride. And I do personally agree that fluoride isn't the best thing when you look at it from all other biological perspectives, but it does help protect the tooth. There is alternatives now. So I still say that the average patient who has average hygiene should probably use it because it's the most effective. But if you have great hygiene, you're on top of it and you're dedicated to it, fluoride can be omitted. But you do want good polish, but you want it to be not too abrasive, because if it's too abrasive, you will take away more teeth, more tooth structure over time. And a lot of people are interested in the whitening aspect, which can either be from a chemical, like a peroxide type material, or it can be from that abrasiveness. But the one that I love, it has a special ingredient that is very good at polishing, but without being too abrasive. And that's what's really unique and what turned me on to it. When I was looking at this 10 years ago, I was looking at making a product and I found it and started talking to them. And instead of making it, I started, purchasing it and considering white labeling. And it's just been a long process. Yeah.
What are some of the worst lifestyle things or foods or drinks that contribute to either periodontal disease or gum issues or
even cavities?
Anything like cavities? Yeah.
Poor oral hygiene, number one. Dietary parts would include frequent sugary or acidic beverages. So every time you have something that is sugary or acidic, your mouth pH changes and it puts you into a state of demineralization. So if you leave sugar behind, the bacteria start digesting it, producing acid. If you have acidic drinks and, like soft drinks, then you're just jumping straight to the point, plus the sugar that's in there. And what happens is your saliva is your buffer. It basically helps to neutralize things. But think of it like that's going to take 30 minutes or so for it to come back. Now imagine you're sipping on soda all day long. You're constantly in a state of demineralization. And so what I see is people that have habits that are very consistently acidic, drinking large soft drinks all day, or large or even coffee, but with sugar and cream all day long. Like, I'm a coffee drinker, and I think that if you minimize, how long you're sipping on it and it's not an all day event, it's perfectly fine. But when you I had this patient, she was putting in, we were trying to figure out what her problem was. She's like, why am I getting all these problems? And I asked about coffee, but I didn't get into specifics. I'm like, no, that's not it. And then I said, wait a second. This was after like months of trying to figure out what's going on. I'm like, do you put cream and sugar? She's like, I put cream and maple syrup. Lots of maple syrup.
My favorite.
Like, oh my God. But I mean, imagine and she's like, I sip on it all day long. It's sticky. It stays on the surface. It gives it the sugar. It gives it the acidity. The cream has sugar in it. So, so those types of things.
Cesspool.
Yeah. That's the big thing, like I'm not a big fan of saying like totally, forego sugar and stuff. It's more about limiting it to a normal period of time. You can have a cookie or sugar
Mhm.
once a day. And also, by the way, you don't want to go brush instantly after. You
That
want to
was
like
going to be my next
rinse.
question.
It was okay.
Yeah.
So you want to like rinse after you have a sugary beverage, soda, acidic something, any of those things we talked about. Your goal should be to rinse out with water, like swish with water and either swallow or spit out. But you want to wait, because imagine the surface of the tooth from something acidic is slightly softened. Now you go brush it right away
Mhm.
and you're doing like an acid scrub. And a severe example of that is the bulimia patient. When
Oh, yeah.
they're bulimic and they go, they have emesis and then they go to actually brush.
Mhm.
What we see is very accelerated wear. It looks like the tooth has been like shrunk in all dimensions
Mhm.
by 30, 40, 50% in a small period of time, like a
Wow.
few years, 2-3 years can already do it, where all your enamel is gone, especially on the back surface.
Yeah.
So that's, one, that problem is really the bulimia, but it's compounded by the fact that the first thing you want to do after that is go
Right.
and brush.
Wow.
Yeah.
Interesting. That was me, by the way.
Oh, really?
In my 20s. Yeah.
Oh, wow.
Oh, yeah. But yeah, I never thought about that, because you think it's just the acid from.
And you want to get it off your teeth. And
Yeah.
so, I mean, the same advice would hold true. You neutralize a little by swishing and you wait.
Mhm.
So same if you have orange juice in the morning or breakfast or something like that, you want to wait a little bit for things to, and it's once or twice isn't a big deal. But if it becomes part of your routine every day to do that, you're going to see a progression over time, depending on where you're starting. That can be faster or slower.
Mhm. Okay. So after my morning matcha,
Yeah.
where I have my teaspoon of maple syrup, that's the only one that I drink during the day. Don't brush right after.
Yeah, I would say don't
Wait.
brush right after. Yeah,
Okay.
I'd swish with water or wait about 30 minutes. Try to incorporate it. Like I can tell you for me personally, I don't put sugar in my coffee, but I have my coffee, I do my workout, and then that's when I brush,
Mhm.
and I have some
Okay.
water right before I work out. And
Mhm.
so that's just kind of how my routine falls
Mhm.
into play.
What about tongue scraping?
Tongue scraping is great.
Okay.
I do it all the time. Yeah. I think,
Everyone says wake up. First thing you do
Yeah.
is tongue scrape.
Yeah,
Is
I do
that
that.
the correct order?
yeah. Yeah. I mean, it
Interesting.
feels good, and
Yeah.
it does, it contributes the most to bad breath. So that, and then you can compound it with like a mouth rinse. Again, I like Closest for
Mhm.
that. It's very good at controlling bad breath, but it's not like an overly strong taste. I mean,
Mhm.
it tastes like chlorinated water. It basically just kills the bacteria that's really responsible for that.
Mhm.
But tongue scraping is an essential for me. I'm always,
Really?
every day.
Interesting.
Yeah.
Yeah, I feel like people say that you shouldn't get up and swallow that bacteria that's accumulated in your mouth overnight. Is that how it works?
I don't personally think so. I mean, you have a high pH, very
Mhm.
acidic stomach. I think if you swallow anything that's getting in there, that's different than entering your circulatory system.
Mhm.
But on the same note, like I do just
Yeah.
get up and want to
For
get it
hygiene
off.
and for
Yeah.
bad breath, yeah.
And you see the stuff coming off
Yeah,
that's the
I know.
combination
I do
of
it too, and I'm
bacteria.
like, whoa,
Yeah, it
what
feels
is
good. What are you using? A tongue scraper or something else?
Yeah, a tongue scraper.
Okay. Some people
Something that I
use-
got at Air One.
Oh, that's
So
good.
I'm sure it's, all natural, organic,
Oh, yeah.
gluten-free.
Is it
tongue
metal,
scraper.
plastic, or what is it?
It's metal.
Okay, yeah. That's
Yeah.
why it's
Yeah.
non-toxic, BPA free.
Okay, so say that somebody wants to get veneers.
Yeah.
Let's just walk them through the process, start to finish.
Sure. So this is my process. And I do
Mhm.
think I put a lot of time and energy into this process. And I had some training in it in dental school that I built on. So first thing is going to be consultation. That's where I can pretty rapidly just get an idea of what the goals are. So if it's to restore 1 or 2 teeth, it's a different goal and objective than if the patient wants, like, I don't like my smile, I don't like how it looks. So I figure it out, and I can pretty quickly determine if it's going to be a few teeth or 10 teeth, because when you're trying to change the smile dramatically, like length, size, etc., then the first step after that is called planning and records for me. That's where I take photographs, digital scan, sometimes impression, but a digital scan is like an impression. And I take those records and then I do my smile design. Not the same appointment, but we take all these records, and I also take any preferences the patient has to try to like incorporate. And now, like an architect, I design the smile, and I do it in a way with, it's called digital design or digital smile design. I have a software for it. And basically you take the 3D model, you design the teeth, you can 3D print the models. And so I have the design, and sometimes I share it with the patient, but oftentimes looking at it in your hand doesn't really show you what it's going to look like in your mouth. So we do this procedure called a mock-up. And in that appointment, you come, and oftentimes this means without ever having shaved your teeth, we can show you what the design looks like. And why can we do it without shaving the teeth? Because the average patient that's getting this type of work wants longer, fuller, more volume to offset a variety of things, including, I got to mention it now, including lip getting longer with age or teeth getting shorter with time.
Yeah.
Both of those things happen. And people always say my smile doesn't look the same. So when we're doing a design, a lot of what I do is called additive designs. And in those cases, I can do a mock-up. But if you have old veneers that are bigger and you don't like them, it's hard to do that mock-up. What we have to do is go to the temporaries, which would be the next step, and then we test the design. But the whole point of the mock-up, or the other way to use temporaries, is to test the design so you preview it. Then we spend time doing what I call design revisions. If you like it, perfect. If I don't like it or you don't like it or we see room, we do another design. We try to get to the point where we have a approved design that you and I like, and then we proceed to making the tooth preparation now. So imagine you've had no tooth preparation. Now I know how much tooth to prepare based on the design. If I'm adding a lot of volume, I don't need to prepare anything. I just need to have like what's called a thin margin around the edges so that it's like a seamless finish. And if you had one bulky tooth or one long tooth, you'd have to shorten or address that so that it doesn't, interfere with the entire design. But that's called tooth preparation. Very minimal. I think we should share a photo of what that can look like. And then comes cementation. Cementation is very meticulous as well, one tooth at a time. So let's recap real quick. We got consultation, records, doing the mock-up, which I fall under the third phase, which is testing the design, preparation, cementation. So 5 phases. It can be as simple as 5 appointments, but if you do 2 or 3 designs, it might end up meaning a few appointments. And I always say it's not worth rushing. I hate the approach where people try to do these designs in the mouth real quick by hand. It takes away so much of the detail that's possible when you actually put the time into doing it well.
Yeah, I was going to say, just having had experience with you and with different doctors, the process was completely different because previously I would go in, we would do pictures, they would put temporaries in for 2 weeks or whatever it was. There wasn't a whole lot of collaboration. And it just kind of was what it was. And then they put the permanents in, and like that was what I had. And with you, I actually have the picture of my digital mock-up. Or,
oh, cool.
So maybe we can share that just so that people can see what it looks like. And it just was very collaborative the whole way. And even I think after I had them in, I think I was like, actually, I want to like shorten this a little bit. And we were actually able to without
doing a whole
impacting, and not impacting like the translucency and everything. I mean, it was like exactly what I wanted.
That's perfect.
Yeah.
So with this whole process, the idea is so many patients, first of all, most of what I do is revisions, and I wish it was more of first time, but people do their research more after the bad experiences. I really wish I could do more and more initial cases, and I'm trying hard for that. But when it comes to revisions, the common theme that I'm always hearing is, well, like, why did you accept if you didn't like it? It was like the staff was saying it looks good. It's the first time you're seeing it. You don't have a minute to think. So when I do a mock-up, I'm not asking you what you think right now. We send you home with it, and it's not strong, but if it's a temporary, it'll be stronger. But if it's a mock-up, it's like a thin shell on top of your teeth. But if you're careful, you can make it last up to a week. Right now, I'm working on a dentist friend, and he's like, send me pictures. He's like biting into things he shouldn't be. He's like, these things are really strong. I'm like, well, they break sometimes. Be careful. But the whole idea is your initial reaction isn't necessarily your final decision. You might end up saying, oh, it looks a little too long. But as you go and you start looking and people around you see it, and these mock-ups look really, really good, then you can form an educated opinion on it without like being kind of stuck with your initial reaction or fear of something like that. Now, imagine the patient that doesn't even get to see them. A lot of patients, their temporary looks like their teeth the way they came in, because that's what's used to temporize. And they're like, oh, it's going to be beautiful. It's going to be all these things. And when it comes, you're tired of the temporary, and because especially when they don't look good, you just can't wait to get out of them. And then you're like being told by people around you, it looks good. I hear this all the time where they're like, oh, the staff said it looks so good. I thought it was a little long. They said they'll shave it a little, but you want to minimize shaving the final veneers. The
Yeah.
detail on the edge, only a little bit that you can adjust there. You want to spend your time designing before that, because if you adjust more than 0.5 millimeter, all the translucency is gone. You're not making the whole top third of the tooth translucent. It's just that thin little 0.5 millimeter. So this is what happens, and people end up with, even, by the way, when you shave the edge, it becomes thicker and thicker looking because the tooth gets thinner as it comes to the edge. And when we shave it in the mouth, it's hard to control that and get the same polish and finish. So that's kind of the common theme.
Yeah, I remember the time that I did them before you. I got my temporaries put on right before Christmas break. So I was going to Turks and Caicos. And I look at pictures now. I look like I had dentures in. Like they were just uniform, straight across, huge. And they were nothing like what was the ultimate result when they put the veneers in.
Yeah.
But yeah, it's alarming because it's so expensive.
Yeah.
It is so expensive. And it's so expensive to redo. So if anybody is listening and they're either trying to shortcut it like I did the first time, or they're just not doing enough research. Like, what's that saying? Do it nice or do it twice.
Yeah.
Or do it right or do it twice.
Yeah.
Like, I think this happens in cosmetic surgery too. Like, obviously, these things are elective. They're very expensive. And, there's sticker shock. And it's like, you try to find a workaround and then you end up having to redo it.
Absolutely. And the other reason I notice a lot of people end up redoing it, which is one of the ones that doesn't get enough attention, it's that when veneers are done, depending on how much tooth is removed and depending on how it's cemented and how much time is spent doing this, they come off. Like, patients are saying, like, I'm always like my common.
Mine came off a couple months ago. One of the ones that you didn't do.
Yeah, exactly. Let's clarify
on
that.
A protein bar.
Yeah.
A protein bar.
Yeah.
I was chewing something and I thought that it was an almond in a perfect bar. And I was like, that is a really hard almond.
Oh my God.
And then I felt my teeth and it was one of my bottom ones that we haven't redone yet.
Yeah. And luckily we were able to cement it. But the problem is, even when I re-cement that, it's not the same. Like, there's some techniques that go into making the veneer stick on the best that can't be done after the fact. One of them is called immediate dentin sealing. And when you have a veneer in hand, you can't really do these things, but I can still give it a pretty good bond. But the best bond that's possible is so good that as of now, and I want to knock on wood if I can find any, I don't, there we go.
Maybe.
I've never had a veneer come off in 14 years now. And so that's like my oldest case is 14 years old. And that's not coincidence. It's because of those steps. But a lot of the cases I'm treating are, one, because they don't like how it looks, and two, because it's like, I can't travel. I feel like they always come out. They do come out. Like, patients always have them coming out. And when I tell them that doesn't have to be the case, there's always some skepticism behind that. But my favorite question to ask people after the fact is, what do these feel like? And the common answer I get is like, they feel like my teeth. They feel like real teeth. But before, even on the patient where it didn't come out yet, they always felt like it's like they described it, it feels weak. And it's hard to put exact science behind that. But I think it comes down to, it's the adhesion is weak enough that they can feel that it's not part of their tooth. It has a little bit of independent movement and pressure buildup. And when you bond it well, that can be very minimized. I'm not saying it'll never, ever possibly come off, but I think I'm cutting down the percentage chance of that complication by well over 90%.
I'm just thinking of something that you said a few minutes ago that I just want to touch on quickly, which is the philtrum gets longer as we age, teeth get shorter as we age.
Yeah.
I was actually introduced to you through Dr. Ben Talley.
Yeah.
So if somebody is thinking about getting cosmetic work or getting a lip lift, they should do that first, right? Before they do dental work.
Depends. It depends on the situation. So in the situation, there's a few different case types, and Ben and I have talked about this a lot. But basically, there's some cases where there's only so much length I can add naturally, and we're trying to get maximum display. So I'll put that there, and he has a little more flexibility on how much lip augmentation is going to be done or how much lip lift is going to be done. There's other cases where we will just put that mock-up on, show him what I have in mind, and he can end up doing the surgery based on the mock-up being in place. Then I can fine-tune after, because I might have a little more room to add a little more length if they're, depending on how the soft tissue or the lip heals. So there's no one way to do it all. We've done it both ways where patient had lip lift before, but generally what happens is when it's identified that the lip lift is going to expose teeth in a way where it's going to be too long, like especially with those veneers that were really chiclety and long to begin with, then the goal is to get it into a more natural size so that the lip lift can be based on kind of a more natural end result.
Mm-hmm. Okay, got it. Let's talk longevity. What is the longevity with your type of work? Mm-hmm.
So what I believe, and I mentioned 14 years is my longest so far, and I can tell you, honest, no complications like veneers coming out. A little bit of chipping over a 10-year period is possible. So what I always try to explain is when you bond it this way, it's as close to a permanent restoration as possible. But when you say the word permanent, I like to say, think of a permanent tooth. Take anybody out there and look at 10 to 20 years of aging. What are their teeth? What happens to their teeth? If they're very careful, they're wearing a night guard and they're taking care of their teeth, maybe not too much, right? But if you are clenching, grinding, and you have a trauma biting into like a fork or something like that, things chip and wear. So I think that 20 years is a fair expectation with adequate care on your part. I highly always recommend a night guard, not because the restorations are weak, but because the average patient over 20 years will make their teeth look a way that they don't like. You know, if you're grinding for 20 years, and it's so common, unfortunately, like everyone's doing some degree of grinding, then you're not going to like your natural teeth. So now that you invested in it, I think you should protect it. I think of a night guard as an anti-aging appliance because I mean you could literally
sold. You've been trying to get me a night guard for as long as I've been seeing you.
Yeah, I mean it really not only does it protect your restorations, but even for natural teeth. Like I don't have any restorations, but I do wear Invisalign or a night guard. Right now I'm in the middle of Invisalign treatment. I was just kind of moving some things around a little to enhance it, but I plan on wearing it. And I was I hope he doesn't hear this, but I was at lunch the other day with my friend who's a few years older than me. I was with my girlfriend. He was with his girlfriend. And I was thinking, you know, he's in the dental profession. And I was like noticing his teeth were worn and chipped and stuff like that. And I was like, he really needs to, one, protect them. And two, it ages him much more. He's only a few years older than me, but like the teeth have a huge impact on how you look and it's very preventable. I mean, even if you don't like how it looks now, you should stop it right there so that it doesn't get accelerated and continue. And then you can continue, you can consider, you know, correcting it. But I always tell my patients, if you're happy with your smile the way it is now, that's all that really matters. But at least try to keep it that way so you don't get to a place where you're not happy with it later, because my goal isn't for everyone to get cosmetic dentistry. It's for people to be confident in their smile, to not feel self-conscious about these things. It's just to not have something that holds you back. That's the real key.
Yeah, I feel like there's so much attention placed on other aspects of anti-aging and just aesthetics and beauty in general. Yeah. And, you know, everybody is obsessing over like, are my temples hollow and the volume in my face? But really the first thing that you look at when you either look at yourself or you look at another person, you look at their eyes and you look at their smile.
Yep. Might be biased, but I really think it's one of the biggest, like I see it all the time. Nothing else having changed, the smile can, I think, reverse, and people tend to agree, 10 years off somebody, you know, because teeth can significantly age you past what other things, you know, like skin and face and all that does. So when you see worn, crooked, chipped, you know, it's just associated with it because it's associated with time. Well,
tell everybody where they can find you.
So my practice is in West Hollywood / Beverly Hills. It's right on the junction. It's on Sunset and Doheny. You can find me on the website hnsdentistry.com. You can also Google me, Matt Nejad. You'll find my Instagram, my websites, all that stuff. And we've talked a lot about cosmetic, but I do all sorts of restorative work, including posterior teeth, back teeth, inlays, onlays. My passion is in doing precision quality dentistry. It's not limited to just cosmetics, and oftentimes people don't realize that. So if you're looking for any of that stuff, it'd be my pleasure.
And your hygienists are great.
Thank you.
This is not an ad, everybody, but I probably, like everybody else, despise getting my teeth cleaned. Yeah. Painless. Yeah, it's awesome. Painless with them. I love them.
I'll let her know. I love
shout out.
That makes me so happy.
Well, thank you so much. We'll also put everything in show notes so that people can find you quickly. And thanks for coming on.
Thanks so much. It's really fun.